Hello everyone, this is Dr. Abinaya Vijayakumar. I'm a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss all about ectopic pregnancy. Let's get started. First and foremost, I have stolen my son's drawing pad so that I can narrate it with drawings. So kindly bear with my drawing. I'm not that good at it. So this is the uterus model. So normally the fertilized ovum will get implanted somewhere in the fundus like this. But sometimes the baby can be formed not inside the uterus cavity but outside. That is called ectopic pregnancy, where all it can be formed. So the fertilized ovum can be implanted near the interstitial region, that is the tube and the fundus connecting area. Number 2, it can be formed on the tubal region. Number 3, at the fimbrial end of the fallopian tube. Number 4, within the ovary itself. Number 5, in the cervical region. And number 6, in the abdominal region, that is outside the uterus. So these are the various sites where ectopic pregnancy can be found. Who can have ectopic pregnancy? Number 1, any woman always has a chance of ectopic pregnancy, but there are certain predisposed conditions which have slightly increased chances of ectopic pregnancy, like if the woman has history of infertility, or if the woman has history of infertility treatment including procedures like IVF, or previous miscarriages, or any structural anomalies of the uterus can also account to ectopic pregnancy. Now, what is the problem with ectopic pregnancy? The only organ to carry the baby into full term is uterus. Only uterus have the capacity of expanding into that 40-week size where the baby can be successfully fully developed and then be born. But if the baby is getting formed elsewhere like ischemic region, tubal region, fimbrial region, or in the abdomen, this can pose a threat to the woman's life itself, because as baby expands, this has a chance of rupture, because of which it can cause great damage to the organs, profuse blood loss, because of which the woman can go into shock and even death. That is the reason we are concerned about ectopic pregnancy a lot, and doctors always advise to get the scan done within 6 to 7 weeks of missed period. What are all the symptoms associated with ectopic pregnancy? The women will always have a complaint of lower abdominal pain. The vomiting can be profuse compared to mild vomiting or nausea. This women in particular can have profuse vomiting, fever, sometimes bleeding or spotting per vagina, and if the organ ruptures, the women have profuse blood loss, because of which she falls unconscious. So, how can we diagnose ectopic pregnancy? Number 1, urine beta HCG to confirm the pregnancy. Number 2, serum beta HCG. Here the levels will be much more higher than that of the uterine pregnancy, because here it would be multifold increase for that gestational weeks, which will give us a clue that this is not a normal pregnancy and it can be an ectopic pregnancy. What is confirmation? An ultrasound scan of the pelvis will show the fertilized ovum not inside the uterine cavity but in the tubes, fimbria, ovary or abdomen or cervix region. This confirms the diagnosis of ectopic pregnancy. Now, what is the treatment for ectopic pregnancy? If the woman is in early weeks of pregnancy with no tendency of rupture or no other symptoms, methotrexate will be the drug of choice. But if the ectopic pregnancy shows signs of impending or ruptured pregnancy, then surgical intervention is the choice. I hope you like my drawing as well as this video. If you like, do like, comment and subscribe to my channel, and do not forget to press on that notification bell icon so that you don't miss out on much more informative videos which are jam-packed in our channel back to back in the coming days. Until I meet you in the next video, stay happy, stay mommified.